So, okay, so I say I go take this fasting insulin test, okay, and it's above 9, and I have bad things in store. There's bad things coming my way, many different things that you just talked about, right?
Yeah.
One, what can I do to not get to that point? And then two, if I am at that point, what are my next 5 moves? What do I do next?
So can I give you my personal example?
Sure. Yes.
All right. So let's back up over 20 years now. Here I am at the top of my career in heart surgery, and I meet a guy who I talk about in the Plant Paradox by the name of Big Ed from Miami, who's got inoperable coronary artery disease. Cut to the chase by following a diet that looks like mine now and taking a bunch of supplements from a health food store. The guy drops 45 pounds and he reverses his inoperable coronary artery disease. Now, what was so interesting at that time, at the height of my career, I had a fasting insulin level of 16, which is insulin resistance, pre-diabetes, whatever you want. I had a triglyceride level of 166 and my HDL was 32. That doesn't sound like 1-to-1 to me. I was obese. Even though I was running 30 miles a week, I was going to the gym 1 hour a day. I was doing 5K, 10Ks on the weekends. I was what was called a Clydesdale runner, which is big fat runner. And yet I had high blood pressure, I had pre-diabetes, I had such bad arthritis, I had braces on my knees to run, and I had this crazy cholesterol profile. And I had no idea that I was insulin resistant. Fast forward 3 months, my insulin level drops to 3, my triglycerides drop to 30, my HDL goes to 82, I lose 50 pounds my first year. I drop another 20 pounds and I've kept it off for 20 years. And so I had all the markers of, man, I'm going to have heart disease like my dad, it's genetic.
Yeah.
I totally flipped that around by changing what I ate. And so I devoted my career to teaching people how to avoid me, which is really dumb as a heart surgeon. Talk about a dumb career move. I mean, really.
But I think that's why people love you, though. You are genuinely loved by people because you're the doctor, you're the father, you're the uncle any guy would love to have, because the way you talk, you make me want to take your counsel, versus sometimes doctors speak to you like you're stupid. Your approach is so well received by the audience.
Well, and the other thing that I've promised everyone who listens to me is that, for instance, in my first book, which was published in 2007, Dr. Gundry's Diet Evolution, I've changed my views based on my continuing research on my patients, who allow me to take their blood every 3 months and ask them to do, here, don't eat that food, or here, go to Costco and get that supplement. And so my views have changed. I've evolved my teachings. And what frustrates me is that I have a number of famous colleagues who, despite 20 years of advancement in research, haven't changed their views one iota on what we should do. And can I give you an example from this morning? So there's a famous, well-controlled diet study on the prevention of heart disease, and it's called the Lion-Heart diet. It's spelled Lyon. It's Lyon, but everybody calls it the Lion-Heart diet study. And what they did was they took people who had a heart attack and they divided them into 2 groups, and it was controlled for 5 years. One group was going to follow the American Heart Association low-fat diet. And Okay, that's the American Heart Association, low-fat diet. The other group had to follow a Mediterranean diet, but they had to supplement their diet with a fat called alpha-linoleic acid. Now, alpha-linoleic acid is present in canola oil, not much, but a lot. Flaxseed oil is loaded with that. The best source is perilla oil, which is the favorite oil of Korean cooking and a lot of Japanese cooking. Anyhow, they were supplemented with this oil. At the end of 3 years, the study was stopped because the group with the Mediterranean diet and the alpha-linoleic acid had so much fewer new events, fewer heart attacks, that it was unethical to continue the study. It was stopped. And so they continued the study for 5 years because the one group that was having that diet, and the results continued for 5 years. Now, so it's been well shown, and that's just one of the most famous studies, that a Mediterranean diet with alpha-linoleic acid in it beats the American Heart Association low-fat diet. And when all this was broken down, it turns out that the only difference that they could find in any blood test between the two groups was the amount of ALA, alpha-linoleic acid, in the blood of the two groups. And the higher, the better the outcome. Now, what that tells you is have yourself some perilla oil every day. So getting back to this morning, I got an email from a patient whose doctor really hated the fact that he was on my program and that he has a history of heart disease. And for God's sake, man, whatever you do, you have to start the American Heart Association diet right now. And it's like, really? Don't you read the literature? Do you want to have a 30% higher rate of heart disease? Yeah, this is what we're up against.